Ethan is saying, my daughter talks about foot pain often, but it doesn't seem to affect her and there's nothing visible on her foot. At what point do you do something? And is that just simply talk to the doctor? I assume a lot of things are growing pains or muscle soreness because she's so active.
I would think if she's repeatedly saying that, at some point I think it's okay to get her evaluated and at least make sure, especially in a young female, that she's not developing a stress reaction. She's not developing any sort of injury that could potentially be really 4, 5, 6 months. I think that there's other elements too. For example, there's, depending on the age, is she anemic? Is she going through her menstrual cycle, and is she vitamin D deficient? So you're going to learn some other things that if you go to see a good clinician, they're going to look at your child and say, hey, you know what? What's their nutrition like? How many calories are they expending daily, right? Are you making sure you're refueling appropriately? Because it is, again, it is a load after load after load. And if you're not filling the tank every day, at the end of the day, you're going in with an empty tank the next day. And over time, that can lead to some bigger problems.
Yeah.
So my answer would be is if they're consistently saying that there's something that's bothering them, I think it's an opportunity to take a step back. And I'm a parent. My children went through the same things. You can sense when you think something's off. And if you ever feel that there's something different, or they're not their normal self, it's okay to say stop. Let's get it checked before we move forward.
Yeah, let's talk about general advice for managing blisters. You good with that?
Sure. Yeah.
Okay.
Don't
So
pop them.
common injury. So or common issue, I should say, not really injury. Common issue that we have. What should parents know about that?
Common injuries, when you look at the studies in our game, lower extremity injuries are the most common.
Yeah.
Whether it be muscle strains, sprains, stress fractures, foot and ankle injuries are obviously very, very common. So your footwear, being able to, especially in children that are growing, Osgood Schlotters and the injuries of the foot that you see, especially in those growth periods, are really important. And so being able to jump on top of them early is extremely valuable. To listen, if a child is developing a stress reaction and is having pain, that they come home and they're like, my foot hurts, and they're walking, but their gait's not altered. You may want to stop and say, let's take a look at this, because if you keep going, you may develop a stress fracture, and you go from something that can resolve in 2 weeks to being out for 3 to 5 months.
Yeah.
So the lower extremity injuries are without question our biggest problem in our game. Hamstring strains and quad strains are things that we see quite a bit as we increase loads. But generally, that's what we see. We have a lot of content on Recognize to Recover.
Yeah.
Carly Richards, a podiatrist, recently wrote something on foot and ankle injuries. So that's a great resource. But that's typically what we see. Blisters, don't pop them.
Yeah.
Make sure you look at the type of shoe wear and footwear that you get. And that's what I would say about those.
Yeah, no, I mean, even something as simple as that, like don't pop your child's blister. If it pops on its own, that's fine, but don't actively do that. That's something that a lot of parents, especially if you haven't grown up playing sports, you wouldn't know. I looked at Dr. Carly, I'm sorry, what was her last name?
Carly Richards.
Yeah, so I saw that article, and something I wanted to mention, this was going to be my next point, was that literally every solution was get a good fitting shoe. So there's such an inclination as a parent, especially with a growing child, when you're making an investment in a cleat, to try to push it up, get like a half a size larger or larger. Can you talk about the importance of a shoe actually fitting a child?
Yeah, so I think the number one thing is, and I think both of you could probably speak to this, is most of the players that wear their cleats wear almost a half size smaller.
Yeah.
The natural thought is that you're going to wear a larger cleat, or you want it to last through the season. And I think those are important elements as a parent to understand, that you want it tight. You don't want a lot of movement in the boot. Now we can dive in even deeper on, some of the things that we're looking at on what sort of cleats are you wearing on turf versus grass. And so you may have to have a variety of footwear. we're actively looking, and I think Nike is, looking at different cleats on potential, ACL injury, prevention. I think we're a ways away from that, but at least those discussions are being had. But be conscious of that. Wear a tight fitting boot, and then be conscious of any symptoms that may be arising.